I am Dr. Naresh Sharma, Senior Consultant Physician based at Chandigarh. I am practicing in a hospital in Chandigarh. So today we will discuss how the understanding of hypertension works out to be. So our discussion is around the high blood pressure and how to prevent it. That is the very common morbidity which is prevalent in the society. So generally everyone would like to have healthy or normal blood pressure, but what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the walls of blood vessel. This is called blood pressure. So normally in a healthy person, it rises and falls throughout the day. But when blood pressure remains high for a longer time and left unattended, it can lead to serious health complications. In general, persistent increase in blood pressure higher than the normal blood pressure, which is called hypertension or the high blood pressure. So high blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices. For example, not having enough regular physical exercise, obesity, and smoking, which is very important as far as cause of the hypertension is concerned. Then high consumption of the alcohol and the stress, which is very important. So these all factors, they come under the cause of the hypertension. Then there are other risk factors which also lead to the development of the blood pressure, high blood pressure in common people. Then age. As we get older, the arteries, they get stiffen up and narrows as excess of fat builds up in their walls. If a family history of high blood pressure is there, one or more close family members with hypertension, then one has more risk of the developing blood pressure. Then if one has a habit of taking excess of salt, that also causes your blood pressure to rise. Then not eating enough foods with potassium can increase the blood pressure, and the risk of the stroke and chronic kidney disease, they are very much common then. Eating processed and fatty foods increases fat throughout the body and make the heart work harder to push blood through the body, hence the causing blood pressure to rise. On the other hand, lack of physical activity is also linked to obesity and further leading to the high blood pressure. And the most important cause is the stress. Reacting to the stress in a unhealthy ways and not managing stress can also increase the blood pressure. So as we move on, the hypertension does not have any obvious sign and symptoms. That's why it is called a silent killer. It puts people at risk for several diseases, cardiovascular problems, kidney failure, stroke, and even damage and blindness of the eyes. So people who don't have any sign and symptom of the blood pressure, basically they suffer the most. And sometimes they land into very severe emergency conditions. Hence, early and accurate diagnosis is very important. In management of hypertension, measuring of blood pressure is the only way to know whether a person has high blood pressure or he or she has a low blood pressure. Generally, when symptoms do occur, and symptoms are usually morning headache, tiredness, vision changes, there's blurring of vision, sometimes there is buzzing in the eyes and ears, which is called tinnitus, fatigue, and there is nausea and vomiting can be also occur in extreme conditions. If a person is experiencing some of these symptoms, then one should get his or her blood pressure checked and find out the cause. Fortunately, high blood pressure can be easily diagnosed. Then it is the positive side of the story that if one has blood pressure, then with medications and with other approaches, that can be reversed or can be controlled. It is usually measured with an instrument which is called sphygmomanometer. Blood pressure recorded in two numbers. Upper one is systolic and the lower one is diastolic. Now let's try understand what these two terms indicate. A healthy normal blood pressure should be less than 120 over 80, or it can also we can read it at 120 over 80 millimeter of the mercury. Hence, the upper number indicates systolic blood pressure or the upper blood pressure, which means the blood pressure in the vessels when the heart contracts, or the lower number indicates when the heart relaxes in between the two beats. So these are the meanings of the upper and lower blood pressure for a layman. If blood pressure is levels, they are more than 140 over 90 in every patient, then the person is labeled as and diagnosed as a case of hypertension. If we measure it for many occasions, if person have BP level higher than this, then he might be at risk of developing serious heart disease and other complications of the hypertension. So by knowing that one has a blood pressure, what healthy lifestyle is, we should go for regular exercise. We will explain this in detail. Healthy diets, one should quit smoking, and there is regular blood pressure monitoring, stress management, and then regular intake of adherence to the medicine. That is very, very, very important. If blood pressure is successfully controlled with such lifestyle modifications, then it might avoid delay or reduce the need of medications. So let us look into all these strategies one by one, how it can help to reduce in the blood pressure. Regular exercise or physical activity is very important in controlling the blood pressure. Regular physical activity makes person heart stronger. If one have a strong and healthy heart, it can pump more blood and with less effort. So if heart has to work less to pump, the force on the blood vessels will decrease, which further lowers the blood pressure. So these are some techniques. In some cases, we all are aware that the age and weight gain are two important risk factors for high blood pressure. So if blood pressure is at a desirable level, it is less than 120 or 80, then exercise can help prevent it from rising as your age is. So regular exercise at any age is very important to control and to prevent blood pressure in younger patients. In our opinion, to control blood pressure, one should aim for at least 45 minutes of aerobic activity, almost 5 days a week. As far as this is the guidelines of the various hypertension societies or American Cardiac Diabetic Society, they guide that one should do 5 days exercise, 45 minutes brisk walk for 5 days in a week. That is important. Then the healthy diet is concerned, very important for controlling the blood pressure. A diet with the high intake of vegetables, fruits, whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through dietary intervention, one can adopt a dietary pattern like that. We have a DASH diet, or we have to eat less saturated fat or total fat. Getting plenty of potassium from various products, we should take all these products. Limiting the amount of sodium or restriction of the salt, and also the moderation in the alcohol consumption and quitting the smoking. So DASH stands for the dietary approaches to stop hypertension. This is the abbreviated form is DASH. So eating a DASH diet that is rich in whole grains, fruits, vegetables, and low-fat dairy products and skims on saturated fat and cholesterol can lower one's blood pressure by up to 11 to 15 millimeter of mercury if one has the high blood pressure. In other healthy people who don't have the high blood pressure, this activity leads to the then reduction of the salt in the diet. Even a small reduction in the sodium in the diet can improve the heart health and reduce blood pressure by about 5 to 6 millimeter of mercury if you have high blood pressure. So to decrease sodium in your diet, you can consider these interventions. One should read food labels. If possible, try to choose low sodium alternatives of food and beverages you normally buy. Then eat few processed foods. Only a small amount of sodium occurs in natural foods. More sodium is added during processing, so you can eat natural products. So one should go for the natural food instead of the processed foods. So one should not add extra salt into various salads and into the food and various all other products. So extra addition of the salt should be avoided at every cost. So quitting of smoking is very important. Quitting smoking means one should, there is, as we all know, that smoking leads to for many cancers like lung cancer, oropharyngeal cancer, oral cancers, and even the peripheral artery disease and various other cardiovascular disorders. They all are related to the smoking. So quitting smoking is very important and it should be done at any cost. Then monitoring the blood pressure regularly whether you have controlled the blood pressure on a regular basis or not. Some of the hypertensive patients, they keep on checking their blood pressure regularly, but they don't go to doctors. But it should be done better. It should be done at home. One should have blood pressure apparatus at their home, and one should check in the morning, evening, and other odd times, so that levels they remain in the normal range. So self-monitoring helps person to measure BP at different times throughout the day and over a longer period of time. It also assists the treating doctor to get a more complete picture of person's blood pressure reading at different times, as I already told. So in order to avoid any cardiovascular morbidity and mortality, the most important intervention is stress management to control your blood pressure. By learning how to relax and manage stress can improve emotional and physical health and lower high blood pressure. Stress management techniques like relaxing techniques, where you relaxing exercises, listening to music, focusing on something calm or peaceful, and even yoga and meditation, other meditation techniques, they all help in reducing stress. And you know, the stress is single most important factor in the pathology of the hypertension. Adherence to medicine is also not a least important, it's very important. A medicine to lower blood pressure by the recommending doctor for your blood pressure should be taken regularly and consistently and should not be allowed to leave. Adherence to medicine is very important as it controls your blood pressure regularly and consistently. So in the last, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adopting healthy lifestyle can help us to enjoy a long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complication, renal complication, visual complications, and even neurological complication. It is very important possible to maintain blood pressure levels with regular monitoring and regular treatment and prevention. Thank you. Good evening and thank you.